Myself Dipali, I'm a student of Group 67-1A. Today we will see what is CPR, how to execute it on adults, children and infants, and lastly we will look into the advantages of CPR. So what is CPR? The full form of CPR is Cardiopulmonary Resuscitation. It is an emergency procedure that combines chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. CPR for adults. In case of an emergency, you may be the victim's only chance of survival. Until an ambulance arrives and professional assistance is available, you can increase that chance by 40% simply by remembering and effectively administering CPR. First, check for responsiveness by shouting and shaking the victim. Do not shake or move the victim if you suspect any sustained spinal injury. Second, call 911. Third, remember CAB. C refers to circulation. If there is no pulse, perform 30 chest compressions at the rate of at least 100 per minute, 2 hands and 2 inches. A refers to airway. Tilt the head back and lift the neck to clear the airway. B refers to breathing. Pinch the victim's nose and give 2 breaths, watching for the chest to rise with each breath. CPR for children. Children's CPR is given to child whose age is about 1 to about 10 or 14 years. The procedure is similar to that for adults with some minor but important differences. First, check for responsiveness by shouting and shaking the victim. Do not shake the child if he has any sustained spinal injury. Second, remember CAB. C refers to circulation. If there is no pulse, administer 30 chest compressions, 1 hand and 2 inches. A refers to airway. Ensure the airway is not obstructed. Tilt the head back and lift the neck to clear the airway. B refers to breathing. Pinch the child's nose or cover his mouth and nose with your mouth, making a tight seal, and give 2 breaths, watching for the chest to rise with each breath. Third, continue to perform CPR for 1 to 2 minutes before dialing 911. Fourth, check for pulse and if necessary, perform the cycle again, checking for pulse every minute. CPR for infants. Infant CPR should be administered to any victim under the age of 12 months except for newborns in the first hours after birth. The procedure is as follows. First, check for responsiveness by patting the infant's shoulders or chest. Second, remember CAB. C refers to circulation. Check for pulse at the brachial artery in infant's inside upper arm. If there is none, perform 30 compressions using 2 fingers, approximately half the size of a hand. 1/3 to 1/2, that is half the depth of the infant's chest. A refers to airway. An infant's head should be tilted into the sniffer position. Do not overextend an infant's neck, as this may close off the airway. B refers to breathing. Cover the infant's nose and mouth with your mouth and use gentle puffs, breathing from your cheeks, not your lungs, as you give 2 breaths. Third, perform 5 cycles, 30 compressions, and 2 breaths for 1 to 2 minutes before dialing 911. Continue performing rescue efforts, checking for pulse every minute until help arrives. Now, importance of CPR. CPR effectively keeps blood flowing and provides oxygen to the brain and other vital organs, giving the victim a better chance for full recovery. Every day, health reports that if CPR is given within the first 2 minutes of cardiac arrest, the chances of survival double.